we are looking at the anatomic origins of the common breast lesions. So the question we want to ask here is, in terms of the large ducts, what are the lesions associated? In this video, we'll find these answers and learn in detail about this topic. So to start with, firstly, we have the lobules and the terminal ducts. So under the lobules and the terminal ducts, so this can include the presence of cyst. There can be the sclerosing adenosis. Then there is also the small duct papilloma. Then comes the hyperplasia. Then there is also the atypical hyperplasia and the carcinoma. So just to recap, we saw the globular and the terminal duct lesions. So this includes the cyst, the sclerosing adenosis, then the small duct papilloma, then comes the hyperplasia, that is the atypical hyperplasia, then there is also the carcinoma which is present. All this is associated with the lobules and the terminal lesions, ducts. So now we look at the large ducts. So what is associated with the large ducts? So with the large ducts, it is associated with there is duct ectasia. Next comes the squamous metaplasia, duct ectasia, squamous metaplasia. And the squamous metaplasia is of the lactiferous. These are the lactiferous ducts. Then comes, we also look at the large duct papilloma. The large duct papilloma, as well as the Paget disease. Now to recap, we saw the large ducts lesions. It includes the duct ectasia, the squamous metaplasia of the lactiferous ducts, then also the large duct papilloma, as well as the Paget's disease. Now moving further, we will look at the intralobular stroma. The intralobular stroma. So what is meant by the intralobular stroma? It is nothing but it includes the fibroadenoma. As well as the phyllodes tumor. Next we look at the interlobular stroma. So what does this interlobular stroma include? It includes the fat. There is fat necrosis, there is lipoma, there is fibromatosis, as well as presence of the sarcoma. Now to recap, we have the interlobular stroma. So that includes the fibroadenoma, the phyllodes tumor. Then in interlobular stroma, we have previously what we saw was the interlobular stroma, and this is the inter. This was intra, this is inter. So in interlobular stroma, there is fat necrosis, there is lipoma, fibromatosis, and the sarcoma. Now we'll be answering our question. So the question we asked was, in terms of the large duct, what are the lesions? So in terms of the large duct, what are the lesions? So these lesions, it includes there's duct ectasia, then there is also the squamous metaplasia. So the squamous metaplasia, and this is of the lactiferous ducts. These are the lactiferous ducts. And then comes the large duct papilloma. There's a large duct papilloma, and there is also the presence of the Paget's disease. So recap, we are discussing the answers to the question. So he asked what is a large duct lesions. So it includes the duct ectasia, squamous metaplasia, and this is the lactiferous ducts. Then also the large duct of papilloma, as well as the Paget's disease. So this was about the anatomic origins of the common breast lesions. To learn and grow daily, please do subscribe.